Welcome back to the Waiting Room podcast, brought to you by onlinedoctor.co.uk. Today, we're talking about something so many of us deal with: aches, pains, and staying active as we get older. Our guest is Stephen McLean from Optimal Physio, an experienced physiotherapist who's passionate about healthy aging and injury prevention. He has a keen interest in conditioning and preparing for sports and has helped elite golfers, footballers, gymnasts, rowers, runners, and karate professionals to achieve optimal performance levels and compete at their best on the international stage. Stephen is also a former FIFA international referee and refereed the Scottish Cup final in 2016. He continues to operate as a referee at the highest level alongside helping his patients stay pain-free and active. Stephen, welcome.
Thank you for having me.
Firstly, I want to ask you about your background in physiotherapy. How did you get into that?
Well, when I was 16, I got an injury playing football and my dad took me to see a physiotherapist. And the experience of going to see him was probably the thing that led me towards the profession. I had a really positive experience. He was a really lovely guy, but just how he interacted with me, how he explained things, and then how he helped me to rehab and get back to playing football. I thought, that was quite a cool job. But as I was leaving school, I really wasn't sure what I wanted to do, and I didn't want to go and do physiotherapy at uni because that made me a physiotherapist. It kind of boxed me in, I feel like. So I went to uni to do sports science against the advice from my guidance teacher and all that. Some of the advice I think you got back then wasn't the same as what you would receive now. And as a consequence of that, that bought me sort of 4 years, enhanced my knowledge of strength and conditioning, nutrition, psychology, injury rehab, biomechanics. But by the end of that 4-year period, I was convinced more than ever that physiotherapy was the right way. So I went back to uni to do my Masters in Physio, and the rest is history. But
all of it wasn't just gave you 4 years, it gave you extra skills that have helped you now as well in your career, is that right?
Yeah, it's really shaped me as a physiotherapist for sure. I think the physiotherapy degree, particularly the master's degree, is a 2-year accelerated course, so it's very difficult to then include everything that I feel should be included. And given how diverse physio is, I think the population and the public, and even people going into physio, probably don't appreciate just how diverse it is.
What do you mean by that?
Well, if you think about every ward on the hospital, there's a physiotherapist on it. So whether you're in stroke, whether you're in cancer, whether you're in
spinal
injuries,
gastro.
Whether you're in surgical wards, whether you're in musculoskeletal wards, whether you're dealing with amputees, whether you're dealing with women's health, whether you're dealing with delivering babies,
or even outside of the hospital, I presume,
and rehab and domiciliary visits, absolutely. So every aspect involved, respiratory, intensive care, and people don't automatically assume there's going to be a physiotherapy in intensive care, but absolutely there is. Infectious diseases, there's all these areas require physios. So when you qualify or when you're doing the course is designed to put you into that environment. And it's therefore really quite broad. Whereas I knew I wanted to go ultimately into musculoskeletal physio. But what they can't do or don't do is they don't then teach you properly about strength and conditioning principles, exercise prescription, nutrition, how the psychology of injury rehab, the psychology of human behaviour, and I think that's what then you have to learn when you start to specialise. And that'll be the same, you don't get taught everything you need to know about stroke or neurological rehab, and if you want to go into that, then you have to then specialise and upgrade your skills. And
so do you specialise after your training in physio afterwards? I think it must be very similar to medicine then. They're so broad in medicine, and then you can't learn absolutely everything, but you get a bit of exposure of a little bit of everything, and then you specialise.
Very similar, I think.
But it's interesting how your journey started with just an exposure to a really good physiotherapist, and it could have been any other medical professional who helped transform your life, and you must be have brought you forward to where you are now, realising the impact that had on you, so you want to make that same impact on other people when you're meeting them, I'm sure.
Yeah, it does make you reflect that when you interact with young people, particularly at that stage of their life, whether it's sort of 15, 16, 17, and they're starting to really seriously consider their options and what they're passionate about and what direction they want to take their life in, then I think you can make real positive change and positive impression in people. And I think we've got to be conscious of that.
Yeah. So part of it was obviously having a great experience, but also it's also wanting to help people, I think, was a big part of why you've decided to get into physiotherapy. What is the main driver of wanting to help people?
Oh, what's the main driver? That's a very good question.
Or what inspired you to kind of focus on injury prevention and healthy aging and helping people in that form?
I suppose, like, there's two parts to that. I think one is, like, as a person, I am motivated by helping others. So, like that, I get a real good kick and reward from like seeing the change in people. So if you take somebody at the start of treatment and the person you met when they're in pain and they're anxious and they're stressed and they're uncomfortable and they're not sleeping and they're a wee bit grumpy and crabbit and not doing the things they like to do, and then you take them all the way through that and then back into doing the things they love, and you see them smiling and laughing and joking, you get to see the real person and how grateful they are and some of the things they say, like that feedback is really rewarding. And like, I appreciate like words, I suppose, like that, if you like. So I find that really rewarding. So then following on from that, then it's like, okay, if that's what I enjoy, like who do then I enjoy actually working with? And when I started in private practice, like at first I started trying to treat everybody, because it's like I'm open and like I want business and like I want to help people and like if you've got an issue, come see me. But I think over time you start to refine who you actually enjoy working with and who you feel you can make the biggest difference and the biggest impact for. And that certainly led me towards the group then that I serve, like people who are active over 40 who take a bit of personal responsibility for their own life already, and just are looking to enhance what they do and also get back to doing what they want to do, but they're committed and they're going to actually implement the things we actually ask of them. And
makes your job a bit easier as well.
It much easier and much more enjoyable. Because they're much more likely to get the success as a consequence.
But also, I think when you hone in who you really want to get inspired by helping as well, they feel that too. Sometimes it feels as a business person that you're narrowing down who you're going to be able to actually serve, but actually you're able to find your people and they can find you as well. And I'm sure you feel that in your clinic as well. And you're able to get the reward of people who are actively helping themselves in the process, and you can just help them on that journey.
Yeah, and it also guides and shapes like your continuous professional development. It guides like what you learn about, and then that again fuels your passion a little bit more. And I think that whole cycle then sort of becomes like self-fulfilling.
Absolutely.
And as a consequence of that, then you can better serve that population.
100%.
And the whole thing rolls on from there. So for me, they're a great group to work with, and we're very fortunate that we've got wonderful clients.
You can see the passion when you talk about it. Alongside all of that, obviously you've had a role as a Scottish referee. Tell us how that came about and how that kind of integrates with the work that you're able to provide in your clinic as well.
Well, it started when I was 16. It was my dad's idea. My dad was a professional footballer and then went into coaching. And at 16, as most others do, all my mates were getting jobs, and getting jobs in Asda or other supermarkets are available. Stacking shelves and working in shops. And the long hours that they were doing didn't really appeal to me.
I wonder why.
And the nature of the job didn't really appeal to me. So my dad had, as a coach, was paying the referees, and he was saying, well, why don't you do your referee badge? And maybe you can referee a couple of games on a Saturday morning, go play yourself for your own team in the afternoon, and then do another couple of games on a Sunday or during the week. And instead of doing a proper job, I would just referee a few games of youth football and enjoy it and get paid for it and help the boys at the club as well, the younger guys. So it was really for that. There was a little bit of a financial incentive initially, but also I love football and wanted to be involved in football, and then from there it spiralled out of control. So if anybody's upset at me, you can blame my dad.
Because football's quite big in the family, isn't it? A few others became players and you decided that wasn't the path for you, is that right?
Well, I'm sure other people decided that was
the path for me.
I wasn't quite as good as my dad and my brother, but
okay.
The opportunity came for me to take refereeing to another level.
Yeah.
That was the direction that I chose to go in. My mates at the time were a little bit, how would you put it? They were surprised at my choices, my life choices.
Okay, fair enough.
Because they were like, why would you want to referee? Why would you want to
put yourself out there?
Put yourself into that position, get shouted at, and do the like the semi-professionals, the juniors, or the amateurs, for instance. And it was where it's a harsh environment, particularly when you're there by yourself as a 17, 18-year-old like kid, really. But I could see that there was opportunities there. I had a lot of support from the refereeing world at that time, in the local Glasgow Association, and other referees who were further on. They gave me a huge amount of support, and that encouraged me to like stick with it through those difficult first few years.
At that age, it must be pretty tough to have to put up with all of that, but to have that support must be incredible.
Yeah, I actually think that's one of the toughest periods for any like young aspiring referee, because you don't have the skills. You don't have the life skills, but you don't have the actual refereeing skills, so you're still learning. And you have adults,
and you've got to make judgments,
and you've got to make big decisions, and you've got adults shouting at you over a youth football game because you've upset their boy or girl.
But obviously, all of that would have given you some skills that I'm sure you've applied to your clinic today. Is there anything that you've taken from your experience as a referee into your clinic today?
Two things. One would be how you interact with people. I think that's really, really important, how you communicate with people. And I think as a clinician, we're naturally very good at like empathy, but you've got to appreciate that you could be dealing with completely different characters. So some people need like a little bit of encouragement. Yeah, and some people need a little bit
telling off, maybe.
Tough love.
Yeah. Fair enough.
And having
definitely do that.
Having the confidence to do that is definitely probably came from refereeing and how I've developed the confidence to interact with people and have those difficult conversations. It's definitely helped me. And the second part is resilience. Like particularly running a business is certainly not easy. And when I started in the clinic as a solo practitioner, it's much easier. But as you then sort of grow, evolve, and start becoming an employer and have so many different moving parts, then things don't go to plan and things don't work out the way you'd expect them to. Then like there's huge challenges come along that really test your resolve. E.g. COVID.
Where that one.
Where things you get a message and then the next day you're closed and you think it's going to be for 3 weeks and it turns out to be 6 months, it shows into 18 months, it shows into 2 years, blah, blah, blah. And then just as you're getting back on your feet, something else happens or like you think you're doing okay and then somebody resigns, and that takes a lot of resilience and there's not many people that you can speak to about that because there's not many people that actually understand what you're wrestling with on a day-to-day basis, as well as trying to be a clinician. So it's the resilience, I think, is something that I developed through football because you're going to make mistakes and I think that's inevitable, but it's how you deal with those mistakes and how you learn and more importantly how you respond. So you don't dwell on them too long.
That's a big one, I'm sure, as well through football. So
the faster you move on, the better. And that's a skill, I think, and that's a skill that you can only learn through really going through those tough periods.
I'm sure as well it's being able to make a decision and being confident with it as well, despite people telling you it was maybe a wrong one. And that's going to happen on the pitch as well as in business, isn't it?
It happens quite a lot.
Yes. I want to flip it around a little bit and talk about a few topics that I know you get exposure to a lot in your clinic that I'm sure some people who are listening would love to learn from your expertise. And the one is chronic back pain, because that's really common. Why do you think it's so common in modern day life?
My belief is that it's because of our lifestyles. Mm-hmm. Our backs are really strong and robust by their design.
Yeah.
So given the how frequent back pain is, like it affects like 8 out of 10 people at some point in their life, and that's likely underreported. So if you take it to the extent that nearly everybody's going to experience back pain at some point in their life, mm-hmm. then I think that can only be derived from our behaviours and our habits. And given how modern day life has evolved, that we're no longer doing manual work. We're not working in the fields as much. We're not working in factories as much. We're not working in coal mines as much. We are now got very sedentary jobs, mostly as a culture. A lot of office-based jobs. More people working from home now. Yep. More people have access to a car or 2 cars, so they're not getting the bus or the train as much. You can see the numbers are declining in terms of people using public transport. The number of people exercising is declining as a population as a whole. So I think those sedentary lifestyles plus our diet and nutrition has changed quite dramatically, which has led to more people being overweight or obese. Mm-hmm. And that combination is definitely what, in my view, was contributing to the majority of low back pain.
It's funny though, isn't it? Because well, it's not funny, but it's interesting that you say backs are so robust, and yet nearly everyone's going to have some sort of back pain. And you'd think that manual labour or something through movement would be the cause of an injury or back pain, but because back pain isn't necessarily injury, is it?
No, it's very complex. There's psychological elements to it. Mostly that's through fear, and because when you get back pain, I think it's so painful, and it's so central to every movement in your body. It can be very disabling. It can be really, really intense, and it's completely different to like just a muscle injury, where I think most of us, certainly in the UK, we're reluctant to ask for help. So we're very good at like getting the head down and just getting on with things and putting up with a little bit of aches and pain and a little bit of discomfort. And that then evolves over a period of time until something actually happens, whether it is a very simple movement like brushing your teeth or bending over to pick something up or sneezing. Yep. And then we feel something really quite extreme. And that is frightening, because then people will assume that they've done nothing to contribute towards the pain. There wasn't a clear mechanism of injury. It wasn't like lifting up a heavy weight. It wasn't a traumatic fall or a traumatic car accident or something
they
of
still
that
think
nature.
There's damage to that, because there's fear when you get that pain. So a lot of, I think, people walk around, if they suddenly get back pain, they think there's something damaged.
Yes, and I think that's understandable, because as children we are educated that every time we get pain is because of usually a fall or like, and that's completely normal, like particularly for that age group and that population. But then we learn, if you hurt yourself, go to the doctors, get some pain relief or check everything's okay, and then go back to normal. And ultimately, probably across our youth, that we do learn that pain equals damage. Yep. But chronic back pain, and what I mean by chronic is pain lasting more than, say, 12 weeks, then the inflammatory processes are different, the pain mechanisms become different. And when you've had pain for, I frequently see people who've had pain for 15, 20 years, like that is not all linked to damage. That's not to say that the pain isn't real. Like, it's absolutely real, but it's not directly associated or correlated to damaged or injured tissue.
Yeah. So what would you say to you, because you said a lot of people put up with pain because, as you said, 8 out of 10, and that's underreported, have back pain at some point in their life. So it's so normalised. I'm sure that must be very frustrating for someone who works in your field, saying, well, back pain shouldn't be normalised. So let's say if someone who's listening has got just grumbling back pain, what would you want to say to them? What can they do?
The first thing is, don't just accept it as normal or part of the aging process.
Yeah.
I think that's what a lot of people just assume, or they tell themselves that it's genetic and it runs in the family. And
so do lifestyles. Lifestyles run in the family.
Yeah, habits run in the family.
Yeah.
That's ultimately what the reality is. But these things are modifiable, and persistent back pain can get better. I think that's the one thing I would say. If you've had persistent back pain, it can improve if you approach things in the right manner, and start to address some of the problems that are maybe contributing to your lifestyle factors, whether there's stress in there, whether that's playing a role in it, whether it's like sleep disturbance, whether that's playing a role in it, whether it's a lack of mobility, whether it's a lack of strength and conditioning, whether it's a lack of consistency, which for most people is probably the
contributing factor, main factor.
Contributing factor.
And so if someone has back pain and comes to, say, a physiotherapist, are they able to help with all those factors?
They should be. An experienced physiotherapist who's used to treating chronic pain and chronic back pain should be addressing all these factors and not just looking to fix, if you like. It should be about enabling and empowering and education.
So it's more than just exercises. Go to your physiotherapist and get exercises.
It's more than exercise, it's more than massage, it's more than acupuncture or whatever the modality is. Like, I'm a big believer in hands-on treatment. Yep. I think it helps. I think it helps motivate people in the early stages. But ultimately, we want to make people independent, and we want to teach people how to understand their own body and how to get their body moving more consistently, and be able to get their body to be able to cope with their lifestyle and what they want to do, rather than just exist. We want them to be much more robust so that they can have freedom of life choices and thrive. Exactly. It's a good word to use.
It sounds like it's very complex, and there's a lot of factors that you look at. But let's say someone has chronic back pain. If they're coming to a physiotherapist, let's say to you, what are they going to expect from coming to you?
I think understanding what their expectations is one of the most important things from an initial assessment and consultation. Like, I think it's really important you go into what the patient's understanding is. Like what is their beliefs about what's going on? What are they really worried about? And then what are their expectations? Like, if their expectations are that they just come in and get massage and they get hands-on treatment and they don't have to do anything, then, well, certainly within my clinic, they're probably not in the right place. Yeah. A lot of people, for instance, with back pain are worried. I would say the number one worry that they have is that either it's not going to get better and that this is going to be them for the rest of their life. And having a little bit of reassurance and understanding that it's not serious goes a long, long way. The second thing is probably that they are worried about it being something really serious, namely cancer. Because particularly in the population I see who are 40, 50, 60, they're surrounded by people who have had cancer or know somebody who has had cancer, and that maybe started as a little bit of back pain or whatever. So given the frequency of cancer, when you look at the rates now, 1 in 2 roughly?
Yeah, 2 to 2.5, I think, yeah.
So the presentation and the frequency in society is something you've got to take into consideration, because if somebody's been speaking to a very close friend or a close family member who's suffered, that other voice in the conversation who's not in the consultation plays a big, big part. So understanding why they're worried about it and then educating them as to why their presentation is not consistent with that is, I think, really powerful.
Yep.
And once you've removed those barriers to treatment, then the fear of making it worse becomes less. So then, therefore, the adherence to doing what actually needs to happen becomes better. You've also brought down their cortisol levels and their stress levels, and then the momentum of change starts to happen.
I can 100% attest for that. As someone who had quite significant back pain, but this was me in my 30s, not 40s and 50s. It was so debilitating so quickly. There was a fear that what if something else was going wrong, which made me not move as much, because what if you made it worse? It kept me up at night. What if it was something bad? And this is during COVID, so we had to be virtual physiotherapists. And literally after a few examinations, obviously have to check it's not something worrying, but within a few minutes was able to say, look, I'm not worried. This isn't something worrying. Let's get you better. Those words made the biggest difference. And just then being able to start moving, and then obviously having the motivation, right, I will get, even the knowing I will get better if we obviously are proactive and follow and be consistent with everything. And the change of that was huge. But just those words, so it just made me realize that this physiotherapist isn't, as you said, just for exercises. It's taking that weight, finding out what are you worried about, taking that weight off your shoulders, and just giving that reassurance you will get better can be a massive difference for someone who has chronic back pain or back pain in general.
Yeah, it can't be underestimated. I think what you've got to remember is we treat people with back pain, or we treat people with knee pain. We don't just treat back pain.
Yeah.
Because otherwise it would just be a recipe and we'd do the same thing every time. And that's, like, the evidence is clear, that's not the best way to go forward. You've got to be able to treat the person that's in front of you.
Yeah.
And reassurance plays such a big part in that, because the psychological part of pain and rehab is huge. And fear avoidance usually then will lead to deconditioning, to weakness, to stiffness, to more pain, more discomfort, more fear. And I think that's where, as clinicians, we've got to be very responsible with our words and choose words that don't recklessly incite more fear. And I think, unfortunately, I don't think that happens across all allied health professions at the moment, but I think we're moving in that direction.
I think you've already demonstrated how much responsibility we have to teenagers who might be thinking of their career, to our patients, but we truly do. And I think it's so important to recognise that and talk about it, so those who are healthcare professionals who listen to this also recognise their role in that as well. So we've talked about how as we age, we shouldn't be expecting back pain. That's not a normal part of aging. But there must be some changes that happen to our joints and our muscles and everything in general as we get older. What sort of things are people expected to experience as they get older?
Well, I think our body goes through a number of different changes as we age, and males and females, for instance, age differently. Like, I think that's
in what way? I'm curious.
Well, males don't go through a menopause. That'd be one fairly major change. As a male, I appreciate how much easier life is.
Okay.
So I'm very grateful for that. But those hormonal changes make life completely different. Yeah. But certainly as we age, for instance, we start to lose muscle mass as soon as we go into our 30s. So we lose between 3 and 8% of your muscle mass every year, like, assuming you're not doing any strength and conditioning work. But then as we get towards our 60s, that accelerates towards 15%.
Every year? Every
year. So the compound effect of that is enormous. Now, that is why, but at the same time as that decline, that's a process called sarcopenia. At the same time, we have DNA damage, we have changes to our mitochondrial health, we have changes to our joint health, we have a slowing, a decline to protein synthesis, which is the repair process. Yep. So effectively the body is constantly repairing itself, and that process slows as we get older. Yep. But then aging, I think a really important myth, or like, aging isn't just a an inevitable decline. I think that's something that's really, really important. It is, yes, it's the advancement of time, and yes, there's changes that happen as a consequence of that, but most of them are modifiable, with the exception of your genetic history, right? So there's some things that we just can't change, right? But I think our quality of life, particularly as we get older, can definitely improve if we make some what would appear simple changes, but they're actually very hard to implement consistently.
Can you give us some examples?
Well, if we talk about sarcopenia as an example, so what that is a decrease in your muscle mass, and a decrease which will lead to a decrease in strength, and also therefore maybe a reduction in bone density. Right? So if the majority of the population is overweight or obese, 2/3 are. So let's accept that as fact. How do we change and we know the direct correlation between that and then diabetes, and then the correlation between that and your comorbidities that come as a consequence of that. So if we want to reverse that, then we really need to start considering how do we build more muscle, and what are the key components of that. So we need to, there's two things. One, you have to be doing strength and conditioning. Yep. And you have to be doing that like twice a week, and it has to be heavy, and it has to be progressive, and it has to overload you. Okay. Right? The second part of that is if we then damage the muscle tissue through exercise, then we need to give it the fuel that it needs to repair. So then therefore we need to give it enough protein to be able to, and if our protein synthesis slows as we get older, then it's really important that we do take in enough protein. So if we look at the guidelines for that, like the World Health Organization suggests that we should take in 0.8 grams of protein per kilogram of body weight. Okay. That's basically...
Is that at all ages?
Yeah. Okay. But it's also wildly inconsistent with the research now. So like it's I think that's what you need pretty much to stay alive.
Okay,
but it's not what you need to use your word earlier on, to thrive.
Thrive, yeah.
Right. If you're doing strength and conditioning exercise, then really you've got to be taking somewhere between 1.3 and 2.2 grams per kilogram of body weight. So I would encourage people to... So if you aim for 1.5 or even 2, if you go to as much as 2. But basically what we're saying is you can take 2 to 3 times almost what the World Health Organization recommendation
And would that increase as you get older? Because one of the things you just mentioned was our muscle repair slows down. So obviously if we're doing strength training and loading, there's damage. As we get older, do we have to adapt how we do our strength training because our repair is going to be a bit different? And maybe do we need more protein because our protein synthesis is slower? Is there any changes that you think people should be making as they progress?
I think very simply, I think it would be if we could just get everybody up to about 1.5 grams and doing the strength training 2 to 3 times a week, and we kept it simple and we didn't make it too complicated for people. Because I think when we start talking about strength training, particularly for the older population, they get intimidated by it and then overwhelmed. And then they go online and there's so much information and it probably creates more overwhelm. And then there's also the fear of injury. That then comes with lifting something. But if you, when we talk about exercises, like I'm a big fan of squats, I'm a big fan of deadlifts, but if you think about the quality of life somebody wants to have, and you think about somebody who's maybe 65, 70, going into retirement, and they want to enjoy their retirement, and they want to go on holidays and enjoy a wee bit of time in the sun and relax and live a little. So they need to be able to walk. They want to be able to walk up hills. They've got to be able to go up the steps onto the aeroplane, and they want to be able to pick their suitcase up and put it into the overhead locker. And more importantly, they want to be able to get themselves on and off the toilet themselves without the help of somebody else. Right? So getting yourself out of a chair is a squat. Picking something off the floor is a clean and press. or a deadlift.
Deadlift, yeah.
Yeah, and being able to carry your suitcase is a farmer's carry.
And it's the overhead one's the clean.
The overhead one, yes, or the overhead
Yeah.
one's a clean press. So like we use
Keep it
these
simple.
words to create almost like exercises which maybe sound quite intimidating,
Yeah.
and sometimes the gym environments can be quite intimidating, which is why probably we have more like female only gyms now, which is I think is a great thing, because the more females we get doing strength training, the better. But also I think that generation, if you go back to what their education was, strength training was never in the conversation. These conversations that we're having is something that's only really happened in the last 10 to 15 years.
So a lot of the patients you must be seeing are almost playing catch up.
They're playing catch up, and they've got an outdated
mindset.
A mindset, yeah. So we've got to update their operating system, and the only way to do that is with education. Yeah. And I think the more discussion we have around about why that's happening and what their beliefs are. So like quite often when people go, well, I go out walk every single day, is that not enough? Like I'm doing my 150 minutes, I'm doing 5 times 30 minutes, like cardiovascular brisk walking every single day. Does that not mean I meet the physical activity guidelines? Well, sadly, no. Like the physical activity guidelines, yes, that's the cardiovascular component, but then you've got your 2 strength and conditioning, and then you've got your 2 mobility or stability part to it as well.
Tell me more about the stability part.
Well, I think exercise has 3 parts to it.
Yeah.
So you've got your cardiovascular, you've got your strength, but then you've got your balance and stability.
Okay.
And I think that's the part that is really important for injury prevention and allows you to do both.
What's involved in that?
Well, it depends what joint we're talking about.
Okay, so it's if someone has, let's say someone already has an injury or is immobile or has got pain in a joint, that you'd add this in, or is this a generic for anyone over 40? They should be doing some sort of stability work.
I mean, I wouldn't even limit it to people over 40. I would have like children doing it very early, like learning good quality movement patterns.
Okay.
And doing the stability and strength work from an early age, I think is going to give them the tools that they need for the rest of their life. But I think what we mean by stability is that you want the joint or the muscles to be able to operate through their full range and be able to work in a controlled, slow manner against gravity. But can you stand, for instance, can you stand on your left leg? Can you stand on your right leg? Can you maintain your balance? Do you have the support in that? But if you're dealing with your shoulder, do you have the stability in your and the control in the smaller muscles, the rotator cuff often, rather than just trying to build our deltoid all the time?
Okay, because this is new to me, I guess, and I'm thinking, someone listening might be like, right, okay, I can understand the cardiovascular aspect, I can understand the strength training aspect. You've got to add this in, right? We've got a busy life, got to add all these things in, and then suddenly hearing, am I meant to add X amount of minutes per week in balancing on one foot or balancing on the other? Is that something you would advise as well?
Absolutely.
And where can they find where to do these exercises?
Well, I think that's why there's exercises such as Pilates and yoga, they exist.
They're good ones.
Because they're perfect examples of that, and they are working on these sort of smaller muscle groups which help with providing the platform to be able to then push or pull and do the bigger, more compound movements, which the compound movements, when you're using multi-joint, multi-muscle movements, are by far the best use of your time and energy. So
that makes more. I got my head around it a little bit more. So it's a variety of different things is what's going to keep you thriving for longer.
Yeah, because ultimately the body adapts to the forces that we place upon it. Yeah. So if we constantly give it the same input at the same intensity, at the same frequency, at the same
it'll stay the same.
It will stay the same. It won't change, right? So what we need, it needs to be progressive, and one of the best ways to progress things is to add variation. So if you add variation, then you're going to stimulate the muscle and the nervous system in a different way, and that will shock and surprise the body so it doesn't know what's coming next.
Yeah.
And then ultimately then you can introduce a little bit of rest every couple of months, which I think is really, really important, so that then you can periodise your training so that you don't reach the status where they're then overtraining or potentially lead towards more injury.
So we talked about muscles and how they change as we get older, but what about the joints and bones and so forth?
Well, osteoarthritis is one of the most common changes that happen to people over 50 as they get older. And a lot of people think that osteoarthritis is inevitable or is a change which results in sort of bone-on-bone contact, and then therefore the only intervention is a surgical replacement.
Yeah.
What arthritis actually is when the surface of the joint starts to change, and as a result of the healing process, we get a little bit of inflammation, it gets a little bit damaged, and becomes a little irregular.
Mm-hmm.
But it responds well to load.
Okay.
So exercise is one of the most important things, because it then exposes the joint to more load, more compression, and it helps clear out the dead cells and expose it to stimulus, which then promotes healing and the body's adaptation to load.
Yeah, which is the adaptation to load is more strength in the bone itself, isn't it?
Yeah. So the bone will adapt the same way that muscle will adapt to strength, but the bone will make slightly different changes to the collagen and the cartilage.
I think a lot of people don't know that. They can obviously visualize if you put strain on muscles, they will get bigger. But I don't think a lot of people realize if you put strain on bone, it will also get bigger.
It'll get stronger. Yeah. And there's the inflammation side of things as well, which happens as a consequence of that. But I think that's where nutrition becomes really important with treating osteoarthritis as well. And if we can reduce sugar, and if we can reduce how much inflammation we have in the joint through how much systemic inflammation we have in the body, then the joint can be much healthier. We can give the joint enough hydration so it functions. It's 80% water. And if we can give it the key nutrients and the key stimulus to recover, then we can improve its function and its quality of movement and reduce the pain. So therefore, albeit we're not changing the underlying pathology, we can improve the performance of the joint to therefore not require or reduce most surgical intervention, particularly those who are in the mild to moderate category. The ones that are in the advanced category, it's a bit more difficult. Yeah. But in the mild to moderate ones, I think that's really important. I think one of the things with osteoarthritis then there is people naturally then assume that it's a wear and tear type condition.
Yeah, that's what most people think.
But the difficulty with that description is that if you assume it's wear and tear, then what you're basically saying is more use means decline.
I've even thought that, and I'm a medical, but obviously I've never worked really in bones or in physio and so forth. That's not ever been my field. So I've even thought that. So what would you say to people who think it is wear and tear and more use would be more detrimental?
Well, I think we've got to really understand what is going on at a cellular level. Mm-hmm. But secondly, what impact is that phrase going to have on the person that we are presenting that to or telling that to? So if you tell somebody that their joint is wearing out and it's a wear and tear issue, then the consequence of telling them that is that they're going to avoid using that joint and not moving that joint and maybe reducing all weight-bearing activity on that joint. Yep. And if you do that, you're going to decrease the bone health. Yep. You're going to decrease how much exercise they're going to do. You're going to decrease
muscle mass.
Yeah. You're going to decrease, but most importantly, you're going to reduce the amount of nutrients to that joint. And then those dead cells, those senescent cells, are not going to get cleared out. Yeah. So there's two ways of clearing those out. One is exercise, and two is starving it of glucose. Okay. So that's where maybe things like fasting or intermittent fasting in particular to really take the glucose away from the joint, deprive the joint of that, reduce the inflammation in the joint, build the strength in the movement around about the joint, make it feel better, lubricate it better, more water, more hydration, and more often than not, you get a very, very good outcome with that.
So the message there is, if you've got early stages of mild osteoarthritis, that it's not, don't stop moving. The answer is get moving, and there is stuff that can be done about it to have some improvement in most cases.
I think it's important that people change their mindset, that it's modifiable and it's not inevitable.
Yeah.
And if we move from that perspective, then we can do things that are going to improve your quality of life. There was a really interesting study done, like for instance, osteoarthritis in the knee is very common.
Yeah.
And then people then assume then that road running is damaging for the knee.
Yeah.
So there's a really, really great study, and it showed that you had 3 groups of people who are more likely to get osteoarthritis in the knee. The recreational runner who goes out and runs in the concrete all the time, the sedentary person who doesn't do any exercise, so therefore doesn't wear and tear their joint more, or the elite athlete who trains intensely. So the people most likely to get arthritis are sedentary ones through disuse, not using their joints, poor nutritional health, loads of systemic inflammation. That creates more DNA damage and aggressively accelerates the process of aging and the process of damage to the cartilage in the joint. Second group is obviously the elite athletes, because overuse, right?
That's where that comes from, isn't it?
That's where the overuse comes from, right? Because they've probably more likely to have had an injury, and that if you've had previous injury, that is a key indicator, because you've damaged it through like playing football, playing rugby, through a twist, and or you've used it to you're pushing your body to its absolute maximum day in, day out for like 10 plus years, 15 years. That group, of course, you're much more likely to get degeneration to the joint tissue. But the road runners were preserved and much less likely to. So impact exercise is good and healthy. So then therefore we shouldn't be using terms which don't positively reinforce that. And that's where I think the terminology of wear and tear isn't a healthy one for joint arthritis.
You can understand that as a patient, we've all got busy lives. We're all patients, or as people, we've all got busy lives. What advice would you give to someone who's maybe not had the mindset yet to start to do all these things, and they are feeling a bit overwhelmed? How would you help someone start? What would your advice be to get someone just starting this variety, everything you've advised, so that they can later thrive and feel confident with it and not overwhelmed?
I think the most important thing is that they need to start, right, somewhere. Right? So it doesn't matter what they do as long as it's more than they're currently doing. Okay. But they don't need to do it all. So as soon as they accept, or as soon as we accept as clinicians, we can't take people from nothing to almost living like an athlete. Like it's a ridiculous journey. And you get injuries if you jump to that as well. Of course. So let's just see if we can make a little bit let's aim for progress, not perfection. And be okay with failing. And I think one of the important parts is if you think about the stages of change, if you've got the pre-contemplators and you're moving them into contemplators, and then they become action people, well, if they're moving from contemplating to action, that's progress for us as clinicians. But what that action is, it doesn't matter as long as it's more than what they're doing currently. And goal setting becomes really, really important, because if they can see what they're doing is creating a change and they're achieving what they set out to do, they'll improve their self-esteem, improve their confidence, they'll get a little bit of momentum, and then we can build the foundation from there. Our job is to provide a little bit of guidance and accountability and emotional support through that process. And without that, they're much less likely to be successful. But what level do we want to get to them probably comes from what their own target is and what their own goals are and what is their motivation for change in the first place. So getting them to tie that all into what their why is in the first place is probably the most important part. If we can link everything we do to their emotional driver as to like why they actually want to speak to us in the first place, why they want to change their life, or are they just happy existing as they are, then if we can bring everything back to that, we've got a much greater likelihood of success.
I was going to ask you how important mindset is in the whole process, but I think you've just answered that 100%.
It's everything, isn't it?
It's more than just guidance in how to get started. It's that emotional support, the kind of tying in with that mindset and to leading them to where they want to be and their why. It sounds like you provide so much more than just exercises, as some people think that you guys do.
And that accountability is really important because let's be honest, life's hard, life's busy. We've got kids, we've got jobs, we've got grandchildren, whatever to deal with, and things happen. We get illnesses along the way. There's stuff happens in life that throws us off course all the time. There's going to be challenges, there's going to be obstacles. We're going to drop off. We're going to have weeks where we don't do what we say we're going to do. We're going to have weeks where we don't eat what we say we're going to eat. I think that's okay. I think we've got to acknowledge that and be kind to ourselves over that. But what's important is not that we go off track, because everybody goes off track.
Yeah, it's really, of course, correct.
How quickly can you get back on track?
Yeah.
And not making one mistake lead to another, which leads to another. So like the classic is, for instance, like, you know, the second order consequence of a night out, right? So you go for a few beers with your mate and you get a little bit hungover.
The kebab. And then
you end up eating not maybe the best food. Yeah. Your sleep's then disrupted. Yeah. The next day you're tired.
Yeah. You don't exercise.
You don't exercise. Consequence of being tired, more caffeine and more sugar. You don't exercise. Do you then go to sleep and then start again the next day, or do you then, I've lost 2 days, I've lost 3 days,
might as well have another beer,
and then before the next night out comes round, and then the cycle continues.
And it's actually being able to have that conversation with people you work with to say that that's actually normal and that's okay. That it's not okay, but it happens. Can we flip it around so that we have a different approach next time? That night goes out.
Yeah, I think it's an awareness of what is the second order consequences of your choices. Like it's not to say like don't have nights out or don't have any alcohol or don't go and enjoy a glass of wine with a meal or anything like that. Yeah. It's not about that. It's just understanding what is the second order consequence, and then how can I make the next decision a better decision. Yeah.
So we talked about strength training being a really important part of someone's weekly routine, really important part of prevention as we get older, and muscle retention. But not everyone has a gym membership. So for anyone who wants to be able to do some of that at home, how can they do that?
It's very simple.
Yeah.
And I think one of the most important thing is strength training just has to be more than what you're currently doing.
Okay.
And using our body weight against gravity, it can be very, very effective, and making it really, really simple. A lot of people, I think, make a mistake of thinking that they need loads of equipment to do strength training. And most people probably don't like going to a gym as well, or find it difficult, or find additional time in terms of transitioning a challenge. So if you're not used to doing any strength and conditioning and you're wanting to start, then it's really easy to get going at home. There's very simple principles that you would need to adhere to, and that is like doing more than what you've previously done, so it's progressive. So if you do a squat, for instance, and you try and take your bum below the level of your knees, and then get yourself back up again without using your hands. So if you're struggling with that, then you have to start with it in a chair. If you can do it and go down and touch the chair and then get yourself back up again without using your hands, and you can control all aspects of that movement, then we can withdraw the chair and then start to go a little bit deeper. If you can do a full squat and then pause at the bottom,
Okay.
and then initiate the movement back up again. We can increase our time under tension. We can make that a little bit more progressive. The slower it is, the more control, the harder it is for the muscles. So the speed at which you do it can make it a more progressive and difficult, challenging exercise. Picking up a simple carton of milk or a heavy bag could very easily turn a movement into a deadlift. You could do a press up or even just a full plank hold and work on your stability. But equally, you can work on your shoulder strength and your upper body strength and your abdominal strength. So the key movements can be done at home without any fancy equipment. We can do things lying on the floor like a side plank. There's huge amount of variation in terms of the exercise depending on what your goals are. Yeah. But I think equally, like a lunge is a very effective single leg exercise. So for people who are maybe a little bit older, one of the things is if you ever had a fall, you'd want to make sure that you could get yourself back up from the floor, like comfortably. So can you, like from a kneeling position, stand back up again? And then can you do that leading with your right foot and equally as well leading with your left foot? Now, if you're over 60, that might be a challenge, particularly on your weaker side, because you will have a more dominant side. But lunges, squats, press-ups, planks, like all very, very effective exercises to do at home.
Well, I took from that is a lot of it's all can be body weight, and it is very simple movements that mimic things we do day to day. But if we want to add a little bit of extra weight or challenge, it could either be time under tension or adding a simple thing like a carton of milk or a bag, something heavy, and then it makes it a little bit more challenging. There you go.
Yeah, and then you can use tins or milk cartons filled with water or filled with sand. You can make your own exercise equipment at home. You can use rucksacks to make things a little bit heavier. There's always a way if there's a will, I suppose.
So it doesn't have to be complicated.
It doesn't have to be complicated, and it doesn't have to have expensive, fancy equipment, but it needs to be consistent.
But speaking of that, you've obviously had a lot of patients, clients along the years. Do you have one story that really stands out to you that you want to share?
It's difficult to pick one because there's so many like amazing ones. I think there's one that sort of springs to mind thinking about that is probably more typical and ties into our back pain conversation earlier. There was a gentleman that came to me with like maybe 15, 20 years worth of back pain, and I'd seen physios in the past, seen chiros in the past, I'd seen the consultant, he'd had x-rays and MRIs, and the next stage was he was wondering whether or not he should really be considering surgical intervention. But he probably, because of fear or because of the nature of the pain and maybe his expectations and maybe where he was in his life at that time, each of the previous clinicians, he probably hadn't given them a fair crack of the whip. He'd maybe only seen them 3 or 4 times, maybe didn't quite get the response he wanted, and then moved on to somebody else to try and find the quick win, to try and find the fix, if you like. He then came to see me at almost like the last roll of the dice before deciding whether or not to go for surgery, and we had a very, very open, difficult conversation about like there's no point coming for 3 or 4 sessions. Like if you've had it for this length of time, we need to address things properly. There's going to be bumps in the road. There's going to be flare-ups along the way. All cards on the table. This is what I would expect to happen. This is the process. Are you on board for that, or do you? Because if you're not on board for that, then really there's no point. He committed fully, and I think that was maybe the one thing that was different to the previous interventions. And we had a couple of flare-ups. We worked through a 6-8 month rehab plan of graded incremental progress, and we'd gone back playing golf, and he hadn't played golf in like 5 years at the time. We restored his quality of life, restored his confidence in his body, his confidence in his back. He could play with his children again. And
Gave his life back.
And he got his life back, yeah. And I saw a completely different person as a consequence of that. And actually, we've ended up becoming quite good friends. His kids are at the same school as mine. So, and we went for a game of golf again last week. So we went a game of golf every year to celebrate his recovery.
Oh, that's brilliant.
And it's quite a nice story, but like that, he's just one example of
to have seen the whole journey as well. But do you think what made you different was probably because you had the hard conversation and you went through his ideas, concerns, expectations, and maybe not everyone's doing that, so it's easy because a patient might not feel heard, or they have a worry but they haven't been able to voice it, and what the person's saying is they're going to do is disconnected, so they think, well, I might as well not try. Do you think that ever happens?
Maybe. I think I often think it's the fear of making things worse that stops people from moving forward, or a lack of confidence in the person that they're speaking to. Yeah. And maybe I don't for one second think I'm a better clinician than other people. Yeah. I don't think their intervention or exercise selection is any better. Maybe it would be a question for him probably more than anybody else, but I think from listening to what patients say, I think it's the confidence in us to be able to resolve that, and maybe the openness of like being really clear and transparent as to what the process is. Yeah. Because I think historically, physios are very good at, or the industry has been very led by how quickly can we get you better, or how quickly can we get you independent. And what that has led to is like, well, okay, we'll assess you at the next session and we'll see how it goes. The next session, see how it goes. Next session, we'll see how it goes. Okay, good, we're making progress, but we'll see you at the next session and we'll see how it goes. But as a patient, seeing how it goes doesn't feel very like everything's in hand. Yes. Everything's under control and I'm where I should be. But as a therapist, if I'm saying to a patient, I'll see how it goes, and I'm expecting the rehab to be 6 months, but they're thinking in their head, I'm expecting it to be 6 weeks. Yeah. Well, we've got a major discrepancy, because once we hit that 6 week marker and I'm still saying I'll see how it goes, then they're going to really lose confidence in me or interest in me. Whereas, for instance, if it was an ACL injury or an Achilles rupture, and everybody's maybe a lot more aware that the recovery is a year, then there's the buy-in that it's going to be a year, and like, okay, we don't need to have that conversation. But with back pain, I don't think we have those conversations. I think it's an important conversation to have, no matter where you are in the medical field, that you have to be on the same page. And I think a lot of patients sometimes get, I mean, you know, we all meet people. It doesn't mean that one of us is better clinician or whatever, but we all have patients who've come to us, and it's clear that they just were on a different page with another clinician that they saw, and that's why they moved on. And rather than getting to the same page first, and therefore able to engage fully with a treatment plan. Yeah, I mean, I think you probably see that a lot, particularly with consultants, and it's not anything against consultants, it's just that their time pressures are so much that the appointment times, and GPs as well, like GPs have like 10 minutes if they're lucky with a patient. It's probably 7 or 5 in reality. Yeah, the NHS GPs, yeah. So if you have 5 or 7 minutes with a patient, what can you realistically achieve? Or if you've got 10 minutes as a consultant, what can you realistically achieve in terms of explaining all the risk profiles, doing what you need to do as well to prepare somebody for whether they're going for a hip replacement or a knee replacement? Do they then really explain to them, okay, this is the rehab that's going to be involved, this is the length of time it's going to take to recover? Or do they just tell them, oh, you'll be back walking or back driving within a sort of 3 month time frame? There's not enough. I don't think people really appreciate just how big some of those operations and procedures actually are and what's involved with them. But again, that comes down to, I think, time pressures and not poor clinicians. It's just the system. But there's obviously, so you obviously have a little bit more time being in private physiotherapy. But speaking of that, you've got your clinic, Optimal Physio. How do patients, if they want to come and see you, how do they find you? Where are you? We have a clinic in Clarkston, which is in the south side of Glasgow, and we have a clinic in Largs, which is in North Ayrshire. Optimalphysio.co.uk is where you can seek us out. We've got loads of sort of free information that's downloadable on the website, because we appreciate not everybody can afford private healthcare. But the real advantage of private healthcare is obviously the choice. You have the choice as to how much intervention you want to have, who you want to treat, and when you want that to happen. So it's one of the reasons that it's a really enjoyable setting for me to work in and operate in, because I don't have the same time pressures I had previously. I don't have the same limitations that I had previously. And I can therefore develop better relationships with the patients and deliver better outcomes, in my view. So it's 2 clinics is that's where we're located, but we also have online appointments as well if people, that's something that developed as a consequence of COVID, and that was certainly a positive. And I think that's when people started to realise, as you mentioned with your own story, is that the hands-on part of it is important. I think that definitely has its role, and people like that. And clinically, I think it definitely has a role as well. But I think that equally it showed that education and good exercise prescription is probably the most important part by far.
And the mindset. And the mindset and the reassurance.
Yeah,
the
which
ideas.
Which is very easy to coach remotely.
Yeah, absolutely. I want to end with a few quick fire questions. Is that all right with you?
Yeah.
So let's start with running. What are the common mistakes and injuries you see when people running?
Too much too soon is the classic, particularly in January, February time, when people have decided after Christmas that they're just going to sign up for a marathon and start running, and they increase their running load far too quickly. So if they, for instance, I much prefer people not to think about their distance that they're actually running on an individual run. Think about what their weekly running load is, and increase their weekly running load gradually, rather than trying to progress runs and runs and runs. What's your thoughts on the couch to 5K? I think it's a good framework, so I'm not against it. I think it depends on what level you're starting from, and whether or not that's appropriate to you, and what your running injury history is like. I think everybody's just got to start gradually and build up based on their own level. I think if they build their foundation, it's much better to build a really strong foundation before you start to introduce any sort of high intensity and speed work. But building your capacity then is, if you're going to if you're going to get involved in marathons or half marathons, then it's an endurance event, and you've got to learn how to endure effectively. Yes. Okay. Second question. What's one myth about back pain you wish would disappear? That you need a scan or an x-ray to find out what's going on. Fair. Okay. I think this is going to be a difficult one for you, but what's your favourite exercise that you love to recommend to people? I'm going to start by saying I don't think there is one perfect exercise. I don't think there's one good exercise, and I don't think any exercises are bad as well. So I don't think exercises are neither good nor bad. But if I was to pick one, I would pick a squat. Okay. I thought you were going to talk about earlier, where it's about planning your holiday. So can you squat? Can you deadlift? Can you clean press? So I thought the best exercise is going on more holidays. Well, I like that. Then you get a bit of everything. Yes. You pick up your suitcase, you do everything, then you got it all. Yeah, and then you get a wee bit of walking, you get a wee bit of swimming, you get a wee bit of relaxation. Some more holidays and we're all sorted. Absolutely. How do you like to stay active yourself? Well, I'm still active as a referee, so I do 2 or 3 run sessions a week. I do 2 or 3 strength and conditioning sessions a week, and I try and do a little bit of stretching as well in amongst all that. So you follow your own advice? I try my very, very best to lead by example, because I think as healthcare clinicians or practitioners, health promotion is something that I think is our responsibility, and therefore got to lead by example.
Yeah.
And I think if people see us doing that, then we can make a significant change to people. For instance, like if the population as a whole is getting older and getting more overweight. So like I think there was a stat I think I read the other day that was since 1965, the number of people over the age of 65 has doubled.
Wow,
exactly, right. And that's only going to increase further between now and 2050.
Yep.
So we're going to become an older society, and at the same time we've got 2/3 of people who are overweight or obese. That's not a great combination. So we need to address that and start working more on prevention rather than reactive cures. And if as a clinician that we can't play our part by taking personal responsibility for ourselves, how can we expect our clients to adhere to advice if we are not sticking to it ourselves?
They won't believe that you believe it.
Correct, yes.
And you can inspire them by demonstrating in your own life how you're thriving because of your following your own advice. And hopefully that in itself can also inspire your patients and the people around you to follow that advice as well. Yeah, I love that. One last quick fire question is worst advice that you've heard about being or going to the physiotherapist?
Worst advice. I think the worst advice is that you expect it to be painful.
Okay.
Because I think a lot of people dread going to see a physio because they think it's going to be painful. It shouldn't be painful. It really shouldn't. Yeah. It should help you. Yeah. It should help reduce the pain initially, for sure. There's conditions where we have to work into discomfort. Yeah. And then there's sometimes, yes, when we're getting moving, initially you're going to get a little bit of muscle soreness, or we're going to get a little bit of joint aches and pains as a consequence of starting to get things going. But that's not inevitable, because again, if people come in and they're worried it's going to be getting more painful rather than less painful, then they're not going to want to come. No. And I think we want people to come and see physios and doctors and seek healthcare intervention earlier, because the earlier we get the intervention, the easier it is to resolve the issue or treat problem. Like treating somebody with back pain who comes to see you and they've only had it for 6 weeks is much easier than treating somebody who's had it for 15 years. Yeah, because the amount of intervention that's going to be required is significantly less. And the habits and everything else. Yeah. I think we are, I'm a big fan of habits, and one of my favourite books is Atomic Habits. Yeah. It's over there. There it is. It is, yeah, there it is. It's one of my absolute favourites. Yeah, fantastic. And we use a lot of the principles in that, like when we're trying to develop new habits, like habit stacking and tagging things onto pre-existing habits. But we've got to make going to a physio easy, yes, or going to see a healthcare professional easier at an earlier point rather than making it harder. Yeah, and I think that's. If we come back to the question of what's some poor advice about physio, I think it's probably that you either expect them to do everything hands-on and it's just massage and a couple of exercises, and they're the only exercises that you ever should do throughout the whole process. It's not. They're the exercises for the first part. But there's either that or there's the it's going to be painful and too uncomfortable. And I think having listened to you probably also might add that you can't go to the physio and not be proactive. Yeah, you've got, it's a partnership. Yeah, it's a team approach, but I think that's true with all healthcare providers. Like, and we should be a multidisciplinary team. Your doctor, your physio should work together to help improve you as a person, improve your health. So the whole thing has to be a partnership. Yeah. And if it's not a partnership, and if it's not a relationship that works as a partnership, then maybe you should seek out a different person, a person that maybe you're going to connect with better and interact with better, because you're much more likely to get a much better response as a consequence.
I love that. I'm going to end that today and say thank you so much for being here. I really enjoyed today's episode. There were lots of things I didn't know before, and I hope you learned lots of new things too. If you want to speak to a healthcare professional about pain, injury, or staying active whenever, wherever, then please visit onlinedoctor.co.uk.